Hello, good evening. My name is Dave Womble. This is my rough draft of my presentation. I'm making a presentation to the cardiology management at my hospital, Jupiter Medical Center. Uh, this is the rough draft, so I'm still memorizing my thing, so I'm going to have to use notes. I know you don't want to, we're not supposed to, but this is a rough draft and I want to get through it. Let's go. Heart disease is one of the biggest killers in America today. When people are sick, they want to be able to get the best health care they can, especially when their lives are on the line. In Palm Beach County, there are 10 different cardiac cath labs that people can go to. We need to separate ourselves from the rest and make sure to find a way to bring in more patients to our facility. How are we going to do that? The answer is having a nursing staff that has a nationally recognized certification. I've been a nurse since 2002, and I know the benefits of having a well-trained nursing staff. The cardiovascular registered nurse certification will create a difference that the patients and the physicians will be able to recognize. It's going to be helpful in that the CVR and credentialing will allow us to attain a magnet status, increase physician confidence, and improve hospitals' profitability. Now, how will the certification help with this? First, having a nursing staff with a national certification will allow the department and the hospital to get magnet status. This magnet status can be used by the hospital in advertising as a way to show the people in our community that we have an elevated level of care. This advertising will help the patients justify coming to our facility versus one that is closer to them. Second, now that we have the extra patients coming, we have to convince the physicians to come increase their case volume. Now, physicians have often said that during complex coronary interventions, one of their main concerns is the ability of the staff. Having a nursing staff that has been able to go above and beyond and attain nationally recognized certification will show them that the people working with them um, are experienced and are educated and are up to date on the latest techniques and procedures. It'll help keep them on the cutting edge, and it will help them be confident enough to concentrate on their own tasks. Now that we have the patients and we have the physicians happy, the third thing we have to keep happy is the hospital. Now, hospitals want a highly trained nursing staff. Um, a well-trained nursing staff can identify, react, and reduce the effects of complications in the surgical area. When we're doing a surgical case and we have a complication afterwards, if we are able to prevent one pseudoaneurysm surgical intervention, that will more than pay for the training and the testing that we're looking for. Complications from medical errors can lead to multi-million-dollar settlements. As recently as 2018, the national average for a malpractice settlement was $350,000. A well-trained nursing staff will help to reduce and mitigate the chances for that happening. In addition, a department that shows it is willing to give extra training to the nurse and a financial reward for it will develop goodwill, and that will aid with staff retention and lessen costly staff turnover. Now, I know what you're thinking. What if we train the nurses and they take their certifications and they leave? Well, the 10% pay increase and the goodwill generated by paying for the preparation and the testing, along with achieving the magnet status, will create a destination position. The question shouldn't be why are our nurses leaving? It should turn into a statement of how many nurses from other facilities are coming to our facility. In addition, instead of asking what if we train them and they leave, you should ask what if we don't train them and they stay. That means we won't be having the best available, and we're going to have nurses that other hospitals don't want. So, in conclusion, there is a path for us to stand above and beyond the competition and become the best cardiac cath lab in Palm Beach County. Uh, what do I what do I need to do to attain this? I'm seeking funds for the cath lab nursing staff to take nationally recognized uh, test class for the preparation, PTO time to take it, and also a 10% pay increase for the staff as a reward for going above and beyond. With this, we will draw patients, physicians, and profits from our other cardiac facilities and become the premier cardiac center in Palm Beach County. Thank you very much.